All right, so it's 11:02. Out of respect for everyone's time, we're going to get ahead and get started as people slowly trickle in. So hi, everyone, and welcome today to part 2 of CPHA's Tobacco and Vaping webinar series sponsored by Kenview. Today's topic of presentation and discussion is strategies to address youth vaping. So my name is Alexi Kim. My pronouns are she, her, and elle, and I am a project officer, online learning and communication for CPHA's substance use project. CPHA is the host of today's session. So if at any point you have any technical difficulties, please look out for my name or my colleague Kelsey. We'll have CPHA listed in our Zoom handles. So we want to begin today with an land acknowledgement. First and foremost, we want to acknowledge that the Canadian Public Health Association's offices are situated on the ancestral and unceded territory of the Algonquin Anishinaabe, who have been the guardians of this land for millennia. We're grateful for their stewardship, and CPHA is committed to working with all First Nations, Inuit, and Métis peoples and their governments in realizing meaningful reconciliation. CPHA is making strides to embed truth and reconciliation in its work, but we also encourage learning at all levels and would urge you to learn more about the land you reside on and embrace opportunities to learn from Indigenous peoples and communities across Turtle Island. I myself work for CPHA, but I'm joining from Tiohtià:ke, Montreal, which is the traditional territory of the Kanien'kehá:ka and has long been a site for meeting and exchange among many First Nations and continues to be home of many Indigenous peoples and communities. So I recognize that I'm a guest on these ancestral lands and that the struggle for Indigenous rights is deeply connected to the work we do here as public health professionals, educators, and policymakers. So a little bit about CPHA. The Canadian Public Health Association is a national non-governmental organization and a trusted advocate for public health in Canada. CPHA works on a number of projects across different areas of public health, including immunization, STBBIs, substance use, among many other topics. And you can learn more about each of our projects at our website, cpha.ca. So over the last few years, Kelsey and myself have worked specifically on a project titled Normalizing Conversation, which focuses on building capacity for a public health approach to substance use. And as part of this project, CPHA hosted the National Conference on Tobacco and Vaping in 2023 in partnership with the Ontario Public Health Association. So this conference was an opportunity for academics, advocates, policymakers, and frontline practitioners to come together to discuss and strategize on the current and future issues facing the tobacco and vaping control sectors. So building on some of these amazing discussions from that conference, CPHA is happy to be hosting this Tobacco and Vaping webinar series, kindly made possible through an unrestricted educational grant from Kenview Canada. So this is the second webinar in the series. The first took place a few weeks ago and was focused on evidence-based policies and practices in smoking cessation. So that webinar recording is now available on CPHA's YouTube channel, and today's webinar will be made available by the end of next week as well. So with that, I'm going to pass it along to my colleague, Kelsey.
Thanks so much, Alexi, and thank you everyone for being here. My name is Kelsey McIntosh. I use she, her pronouns, and I'm a senior project officer at CPHA. So as Alexi mentioned, we hope that today's discussions and presentations will build on some of the momentum that was created at last year's conference and in our webinar a couple of weeks ago. And of course, recognizing that there's limitations in an online space, we hope to use a few different tools on Zoom to help make our discussions today as interactive as possible. So firstly, you'll of course see your chat function. We've had lots of people giving introductions in the chat already at the bottom of your screen, and this is a great way to exchange with other participants, to share any comments or experiences that you have related to today's topic. And we'll be using the chat during moments of conversation and engagement, and we'll be muting it a few times during our presentations today, so you can feel free to direct any questions that you have for our panelists into the Q&A box that you'll see at the bottom of your screen. So we just want to make sure that none of our questions get lost in the chat. So the Q&A will really be the central place that our moderator, Rosa, today will be able to monitor and direct questions to our panelists. So you can feel free to post your own questions there. You can also upvote or comment on questions that have been posed by other participants on the call. And we'll be taking a short break about halfway through our webinar today between our panelists' presentations, but of course, feel free to take breaks as you need. And we'll note, as Alexi mentioned, that the webinar today is being recorded and that recording will be made available, but the slides will not be posted. So we'll begin with some introductions. Very happy to be able to introduce our speakers and our moderator for today's webinar. Firstly, we have Dr. Tricia Tulloch, who is an assistant professor in the Department of Pediatrics at the University of Toronto and a pediatric subspecialist in adolescent medicine. In addition to completing a fellowship in adolescent medicine at the Hospital for Sick Children in the University of Toronto, she completed a clinical fellowship in addiction medicine at the Centre for Addiction and Mental Health, and she's currently a staff physician and project investigator at the Hospital for Sick Children in the Division of Adolescent Medicine, and a physician within the Intrepid Lab at CAMH. Dr. Tulloch has clinical and academic interests in youth and young adult tobacco and vaping cessation, and she continues to enjoy teaching pediatric, family medicine, psychiatry, and addiction medicine trainees. So thank you so much for joining us today, Dr. Tulloch. We're really looking forward to hearing your presentation. Next, to introduce our second speaker, we have Les Hagan joining us. Les is the Executive Director of Action on Smoking and Health, or ASH Canada, one of the country's leading tobacco control organizations. He's also an adjunct professor at the School of Public Health at the University of Alberta. For the past several decades, ASH has played a leadership role in shaping regional, national, and global strategies to reduce tobacco use and nicotine addiction. In 2018, Les received a meritorious service medal from the Governor-General of Canada for his contribution to tobacco control and public health. Thank you so much for joining us today, Les. And finally, I'd like to introduce Rosa Dragonetti, who will be our moderator for today's session. Rosa is the project director of addictions education and research at CAMH and plays a key role in developing a strategy for education research and programming initiatives, including the TEACH project, which is a University of Toronto accredited certificate program in tobacco cessation for healthcare professionals. Rosa led the development of an extensive online program offering several courses to support the certificate program, and started at the Addiction Research Foundation in 1992 and has been at CAMH since 2000, working in education, research, and as a clinician. She's developed treatment protocols and manuals, published several book chapters and journal publications, and has delivered numerous presentations, including international events. So we'd like to extend a warm welcome to Rosa, Dr. Tulloch, and Les for being here with us today. And with that, I'll invite Dr. Tulloch to share her slides, and we'll pass it over to you, Rosa, to get us started.
Great. Thank you, Kelsey and Alexi, and welcome everyone. Welcome back to those who attended part one. I'm going to, as was explained, I will monitor the chat and the Q&A and grab your questions. And I'm here to support the key presenters, so I will stop talking and hand it over to Dr. Tulloch to share her extensive knowledge in this area.
Thank you, Rosa, and thank you, Kelsey, for the introduction. Really, it's a pleasure to be here. I'm looking forward to this discussion and engaging in further in terms of this topic. I also just wanted to make sure that I acknowledged and just stated really a huge thank you to those who provided questions prior to this workshop. It was, I think, really helpful, and I hope that it will inform the discussion that we're about to have. So I will proceed. So I have no disclosures, and I was just hoping to point out that I'm hoping that we'll have a little bit more of a discussion as we go through the content. And as mentioned, it would be great if you could provide some of your responses using the chat feature. And so I'll indicate when we'll have that opportunity to do so. Okay. So in terms of the objectives, so what I'd like to do is provide a brief overview of e-cigarette use in terms of the national trends, and then discuss e-cigarette use in terms of the associated health implications specific to youth. We'll also briefly review adolescent development, specifically as it pertains to e-cigarette use, and in terms of, in addition to the interventions and cessation, approaches. And finally, we'll engage in a case-based discussion incorporating evidence-informed strategies in terms of looking at the reduction of youth e-cigarette use and the promotion of cessation strategies. So just briefly for terminology, when we refer to e-cigarettes or vapes or vape devices, we're referring to a wide range of products that produce an aerosol, which is inhaled, an aerosol being the heated e-liquid that's inhaled through the vape product, and vaping specifically as the behavior, the active inhalation and exhalation of the aerosol product. There are a variety of names for vape products, as I'm sure we're all aware, but just to show and demonstrate the list of these, and throughout the presentation on my end, I'll often refer to either e-cigarettes, vape products, or vape devices. I just wanted to point out the types of e-cigarettes, specifically open versus closed. So those types of e-cigarettes that can be filled manually by adding a liquid into a tank or a pod, and those that are pre-filled disposable cartridges or pods. In addition to those, in terms of the closed types of e-cigarettes, we can also see the disposable devices for single use, and they're disposed once depleted in terms of either the vaping liquid and or the charge. And I'm mentioning this specifically as we think about engaging youth in a discussion about the amount of nicotine that they consume. It is critical to understand and ask about the device or the vape product that they're using. As an example, when one is using an open or manually filled, either a tank or pod, typically the amount of nicotine is significantly higher. And so it's important to understand that distinction. In terms of what's in e-liquid, I'm sure, again, we're all familiar with the nicotine flavors in terms of the chemicals, propylene glycol or glycerol. Just wanted to point out that we often ask a young person about the amount of nicotine that they're consuming. And as of July 2021, in terms of the legislation, the maximum amount was from what we understand to be maximum concentration of 20 milligrams per milliliter. However, most of the young people that I see in clinic are often reporting upwards of 50 milligrams per milliliter in terms of the vape products that they're using. And we'll come back to that later on in this presentation. With respect to the national data, so the Canadian Student Tobacco, Alcohol, and Drug Survey, this is the data from 2021-2022. There's roughly 30% of students in middle school and high school, so grades 7 through 12, that reported trying an e-cigarette, and 8% that reported vaping nicotine daily. In terms of the data from the Canadian Tobacco and Nicotine Survey, which was previously the CTAD, so the Canadian Student Tobacco, Alcohol, and Drug Survey. So this is data from 2022. When we look at past 30-day vaping history, young people ages 15 to 19 reported, there were about 14% of those who reported use over the past 30 days. So this is the more recent data from Ontario. So this is the Ontario Student Drug Youth Survey data. And I just wanted to point this out specifically to address early initiation. So what was noted was that roughly over 40% of secondary school students who vaped in the past year reported that they initiated vaping before grade 9. So I really wanted to emphasize this as we think about strategies, and we really think about the population that we really need to be targeting, that this starts early. In terms of the health implications, there is a fair bit of data now with respect to the health implications, and I'm just going to point out some of the information that that came from a few studies, one in particular from our group at CAMH. So this is the Vector project, so the Vaping and Electronic Cigarette Toxicity Overview and Recommendations that were produced through a collaborative of international subject matter experts, and also with from those with lived experience. And so when we think about some of the health implications in terms of the consensus around those that we essentially all are concerned about and consider to be significant and evidence-based, with respect to cardiovascular health implications, increased heart rate and blood pressure, which can be significant for a young person, particularly if a young person isn't aware of these symptoms. And it may be, in terms of an implication with respect to their chronic health condition, it also may be that they're symptomatic and not recognizing that these symptoms are related to their use. With respect to the respiratory symptoms, there was a consensus with respect to the increase of self-reported symptoms consistent with asthma. And that's particularly important for a young person who may have a history of asthma or a history of the use of inhalers, and may not necessarily make the correlation with an exacerbation of their symptoms as they may continue to use a vape product. And we certainly have seen this in terms of the hospital setting, where we've had young people present to hospital with an asthma exacerbation. And some of the young people have actually required an admission to our critical care inpatient unit. In terms of the neurocognitive effects, we know that there is an association with significantly lower scores in a higher order cognitive functions, particularly in oral reading recognition, auditory comprehension, compared to those who are essentially non-users. When we look at early initiation, so as we were just previously looking at that data, that recent data from Ontario, just to put this in context, early initiation of use has been associated with lower area and volume in the prefrontal cortex. And this is significant for young people because this is the stage of development where we're looking at the development of the prefrontal cortex. And so we can only essentially extrapolate that this could have a significant impact on a young person's developmental trajectory with respect to the neurocognitive impact or effects as a result of vaping nicotine. And so essentially, as a result of these lower volumes, what we see and what the data shows is that this suppresses executive functioning. Oops, sorry. These changes may also increase the risk of developing psychiatric disorders and cognitive impairment later in life. As we just mentioned, psychiatric manifestations with respect to the mental health effects, we know that there is impaired capacity with respect to maintaining attention and impulse control. And as we can imagine, that is those are the symptoms that we would often ascribe to inattentiveness, which may be, ascribed to ADHD or attention deficit hyperactivity disorder. We can also see an increase in terms of the risk factors with respect to concurrent mental health disorders and substance use disorders. And I didn't add this data here, but there was a very recent publication from our colleagues here in Toronto, and they did find in their recent publication a correlation with increased depression or depressive symptoms that were consistent with depression and e-cigarette use. Physical injuries are also concerns. So this is a publication from the UK looking at the physical injuries that were ascribed to vaping or using vape products, and the injury pattern and what was noted in this publication. And they were particularly concerned in terms of the severity of the burn injuries and where these burns were localized, hands, face, groin, and hip area. This could be particularly important for our young adolescents, as this is the time during their development where physical appearance, body image is typically of utmost importance. With respect to neurological symptoms, the symptoms that we sometimes may not necessarily consider, or not necessarily symptoms, the the presentation of seizures secondary to immediate inhalation and toxicity secondary to nicotine. This is often overlooked and may not be a consideration if we had a young person presents with a unprovoked epileptic episode, and we may not ask the question specific to whether the young person has been using a nicotine-containing e-cigarette. And as we just mentioned, toxicity with respect to nicotine in the context of neurological symptoms. These are the common symptoms that we often hear about from the young patients that present to us. And they often report abdominal discomfort, dizziness, headaches, increasing anxiety, difficulty with concentration in the setting of consuming high levels of nicotine. And when we think about nicotine withdrawal, the more common symptoms being irritability, anxiety, and anger and restlessness. And I particularly wanted to point out these symptoms as we consider the context. So, for example, a young person who might present to a hospital setting or a clinic where they may not have access to their vape product or their vape device. And we may then note the irritability and anxiety or anger or restlessness. And this may not be a consideration in terms of the presentation of acute nicotine withdrawal. And we'll talk about that a little bit further as we have the opportunity to talk about a case. So this is the first question that I would just like to point or have us consider. And if you have any thoughts, please consider responding using the chat feature. So if you are maybe working with patients and you had a young person who presented to your clinic or you're in a clinical setting where you noted that there was increasing restlessness, anxiety, and potentially maybe it was related to nicotine withdrawal, what would you consider doing next? And just some thoughts about that context, or if it was a young person in school. So what are some of the considerations and what would you do next? I can't unfortunately see the chat feature.
I can
So
do
I'm
it,
sorry.
Trish. I was just waiting for the
Oh,
announcement to stop at CAMH. Yes, I'll just read them out for you. Somebody suggested NRT for adults. Let's see. Invite conversation with them, not lecture.
Yeah.
Advise the patient how nicotine is a stimulant and discuss the side effects.
Great.
Discuss common symptoms of withdrawal and ways of coping.
Excellent. Yeah, and that's exactly the theme. It's really to use this as an opportunity to engage in the dialogue and offer treatment if at all indicated. And we'll talk a little bit further as we get to the treatment section of this talk. And so this will be the young person that we will talk about, which is Colin, who's a 15-year-old male. But before we proceed and talk about Colin, just wanted to point out a few essentially features of adolescent development, and just so that we can have that as some considerations as we think about interventions and cessation strategies. So this is another question for the group. What are the cognitive changes that occur during adolescence? I think I kind of maybe pointed out a few at the beginning, but just as maybe a little bit of a refresher. See if everybody's awake.
Nothing so far. Oh, there we go. Okay, the brain is still developing and maturing into the 20s. Prefrontal cortex specifically is still growing. Pathways are being developed. Develop personal morality code. Oh, so it's going so quickly. I just lost. problem solving and reasoning, sense of self and autonomy, emotional
Wonderful.
regulation.
Great. Okay, exactly. I think we definitely are, everyone's on the same page, which is excellent. So there are three main stages of development: early, middle, and late adolescence. And why that's important is, although we think about age, so the chronological age, we really need to consider where a young person is in terms of this stage. So if we have, so Colin, for example, a 15-year-old male, would typically, from a chronological standpoint, meet that the middle adolescent essentially stage of development. However, in speaking with Colin, we may ascribe some of his presentation to be more in keeping with early adolescence. So if we think about early adolescence from a cognitive standpoint, early adolescents tend to be more concrete. They are concerned about here and now, cause and effect, and their relationships would tend to be not as fully developed. They are developing a stronger sense of self and social awareness. But these are the young people, when we think about our middle school adolescents or pre-adolescents, this is what we tend to see. And with respect to autonomy, they may start to challenge autonomy. In fact, they typically do challenge autonomy. And this is really the first stages of where we might see more of the disagreement, which may be described as being more argumentative, or potentially not necessarily aligning with parents or caregivers. In terms of middle adolescence, this is when we start to see a trajectory towards more abstract thinking. The young person tends to be more self-absorbed, and there's now a shift towards more and more autonomy. Definitely more conflict during this stage. So this is right around grade 10, getting towards the kind of the latter part of high school. And then, as we've already described, people have already mentioned that we're progressing towards more autonomy, more abstract thinking, more future-oriented approaches, and we're seeing that cognitive development, which is ascribed to the prefrontal cortex. And so why this becomes important is, if we think about, again, stage and not necessarily the young person's age, and we think about where Colin is, so this is the case that we'll talk about, we do really need to consider where the young person is as we start to engage in dialogue, particularly as we're maybe providing some recommendations and getting a sense of as to where Colin is in terms of response or receptiveness to maybe the topic or engaging in the topic. So this is Colin. Colin is a 15-year-old male, and he's been now essentially caught at school with his vape device in the bathroom, and his concern and only concern is that they took my vape. And so the school then notifies the parent, and interestingly, the parent is wondering why the school is called, isn't really sure why they're concerned about vaping, because this isn't, it's cannabis, and that's it. And so they're a little bit dismissive of the concern. But essentially, the plan is to have further discussion with the parent and Colin has been excused from school, and there's a discussion about a suspension, etc., in keeping with where we are in terms of some of the more newer approaches, or yes, essentially newer approaches with respect to our policies. So curious about what we might consider to be some of the let's start with maybe, and maybe in the interest of time, actually, I'll say barriers as we think about an approach that would allow us to appropriately collaborate with Colin, the school, and the caregiver. And I know that everyone has maybe variations in terms of their role, but just thinking about how we might move forward and approach that discussion, and what would the barriers specifically be?
Okay, so one is recognition of risk. Parents don't know about their child vaping. Language, misinformation and timing, lack of understanding of the harms, convincing the youth that they are not in conflict with social worker in helping him explore readiness for change, age and gender, lack of school policy on vaping. Schools are overwhelmed and lack of staffing. Yeah.
So great. And I recognize we might not have the opportunity to talk about everything that comes out in the chat. So hopefully we can have an opportunity to, over this period of time that we have to address anything that we've missed in terms of all of the comments and questions that are coming through. But thank you. That's wonderful. There's a lot there. And so I think just going back to the initial piece about asking to getting a better sense of where those gaps are in terms of knowledge. And in this case, really, it's not only with Colin really asking if there is, and it sounds like there would be an opportunity to engage in a dialogue with the parent. This is an opportune time to do so, given that it sounds like the parent is already at least privy now, given that the school has communicated with the parent. So we'll start with it, asking those questions. And the question that often comes up is, well, now that we know, why do adolescents tend to use e-cigarettes? And I'm just going to move forward, given just in the interest of time, to provide a bit of some of where the data is. And so we know that with some of the study, the most common reasons for vaping among youth ages 15 to 19, so we're thinking about past 30-day use, it typically is associated with the perception that there's a reduction in stress with their use. So with this particular study, it was roughly about 30% that reported this as being the primary reason, the most common reason for vaping. And then curiosity being the next, and pretty close in terms of percentage as well. And really for enjoyment. And so what I often hear is that the buzz or the high tends to be what the young person tends to seek. We can ask clearly, you can ask Colin a little bit more about why he enjoys vaping or why he continues to vape, and he lets us know that it's actually that he would like to alleviate anxiety, and he's motivated to stop using as well. So now we're delving into a bit more of a conversation, as it seems to be that Colin may be treatment seeking. So the additional information that we can gather, and we'll talk about the details around what he's using in the treatment approach, but just getting a sense of his readiness and motivation, asking a bit more about how important it is for him in terms of cessation, getting a better sense of maybe where those gaps are with respect to knowledge, and that was brought up in the comments that were that came forward with the last question, asking about how confident and how comfortable. And I typically, and I would encourage to provide not only the question for an open-ended answer, but also to get a sense of the a scale as to how ready or the degree of, in this case, importance, knowledge, confidence, and comfort. There are a number of tools that are validated with respect to engaging youth in a discussion and acquiring more information with respect to substance use. And this is one of the tools. Why I'd like to point out this tool in particular is that it actually has been tailored, revised in a way that it allows you to ask more questions specific to vaping and vaping nicotine in this particular setting. So the craft allows for 6 specific questions after asking about use that correlates with the DSM-5 criteria for substance use disorder. And you can see there the correlation with respect to the score. If a young person scores essentially greater than 4 or higher out of the 6 questions, you can see that there's a definitive higher or significant correlation, with a substance use disorder. And we're speaking directly today about nicotine use. And so, as I mentioned, this tool has been revised in such a way that there are questions specific to vaping nicotine. And so we can see on my right, your left, where the questions start with the following questions. Ask about your use of any vaping devices containing nicotine and or flavors, or use of any tobacco products. And then there, the young person's asked to circle their answer. These questions are similar to the Hooked on Nicotine tool. And so you might notice that similarity if you have an opportunity to use this, this questionnaire. So again, this is a way of engaging in a dialogue with a young person, but also gathering enough information in a way that allows for there to be a framework, but it also facilitates moving towards diagnostic clarity with respect to their substance use. And in this particular situation, as we're talking to Colin about his vaping. There's also a brief tool, which is the e-cigarette dependence scale, 4 items, and the higher the score indicates a higher level of dependence. So this can also be used initially and over time during assessments. The 4 questions being, I find myself reaching for my e-cigarette without thinking about it, never, rarely, sometimes, often, and almost always. The second question being, I drop everything to go out and get an e-cigarette or e-juice. I vape more going into a situation where vaping is not allowed. And the last question being, when I haven't been able to vape for a few hours, the craving becomes intolerable. So these are the tools that are also found, specifically the cigarette dependence scale tool. It is found on the Center for Addiction and Mental Health at the where the Nicotine Dependence Lab, or now the Intrepid Lab website. So that's a resource that you will find a number of tools in addition to this tool here. So there's also a number of studies that have been looking at adolescents who are treatment seeking. And this is a population-based study, which is roughly about 1,500 students who reported vaping, and roughly about 2/3 had tried to quit over the past year. And the common approaches that they reported were, in fact, not using any resources. The next is peer support, internet-based support or behavioral interventions, mobile apps and text messaging, and parent support. And we'll speak a little bit more about that as well. And when we looked at the youth who used their vaping product daily, they reported challenges with reducing or stopping their use. And it was in this particular study, 44% of the adolescents ages 12 to 17 reported an interest in vaping cessation, yet only 25% were unsuccessful with their cessation attempt. So the message being that young people are definitively treatment seeking. They have an interest in cessation and strategies, but we do certainly see that there are, even with attempts, that there's still a proportion of young people who are unable to maintain their cessation attempts. So what motivates a young person towards cessation? The data actually suggests that health implications, current and future, more and more reported as one of the reasons towards the motivation towards cessation, and financial cost. So we're seeing more and more of this being reported in the literature. At the end of the day, what I would glean from my clinical practice and a fair bit of the discussions that we tend to have with respect to this topic is that it really does depend on the individual. There's a lot of variability. The context matters, and it really is important to meet the young person where they are. So as we delve into more of a discussion with respect to treatment, these were a few of the questions that came up. There were questions about apps and programs for Canadian youth with respect to efficacy and pharmacological interventions, specifically nicotine replacement guidelines for adolescents. who were treatment seeking. So we'll delve into a little bit of that information as we have an opportunity to go back to the case. But I'll start with the behavioral vaping cessation interventions, as that was certainly where a fair bit of the data lies. So this is an American online program, and it is through the Truth. It is the Truth called the Truth Initiative, and it's a digital text messaging approach. And the digital text messaging program is called "This Is Quitting." And the publication was in was in JAMA, the Journal of American Medical Association, and in internal medicine, and they looked at the effectiveness of vaping cessation with this text message program among young adult e-cigarette users. What was significant was that they did see that there was an increasing likelihood of achieving vaping abstinence when they looked at the comparison of the treatment versus the control group. And I've just put the findings here. And so the findings were that young adults who received this intervention had significantly higher vaping abstinence rates at a 7-month period as compared to the control group. So that's an example of an online or internet-based intervention. There are a number of other online programs, and there are some programs here that we're aware of, whether it be provincially, as I'm currently in Ontario, and also across Canada. Quash, through the Lung Health Foundation, is a cessation strategy that uses an app-based approach, as well as Crush the Crave. And so there's increasing data that's been published about the efficacy of these cessation strategies. And we mentioned when we looked at the data related to treatment strategies and the treatment approaches, that the cessation approaches that young people report that they're most inclined to use in the event that they're working towards cessation. And peer support was noted in that study that I had previously mentioned. There is a peer support approach that is currently underway through Health Canada, and I have a bit more information about that in a few slides. And so these are social contracts between peers, and it can be a very structured approach or semi-structured. And there, in addition to those cessation strategies, there are text and phone services, such as the Quit line, which is a pan-Canadian Quit line. The approaches that enable the use of coaches. So this pan-Canadian Quit line also engages coaches who can provide support through text messaging or phone services. And of course, young people can also engage in speaking with a clinician. I'm just wanting to point out the importance of education and ensuring that we enable or we use opportunities to challenge myths and offer whenever possible facts and resources. So not an experiment is, I think a few people may be aware of this really incredible resource. And what I can say anecdotally is that young people who have actually had an opportunity to see some information with respect to the environmental impact of vaping, which is what's noted on this particular clip. If I could play it, I'll try to do so. But they've reported that was essentially one of the reasons for their motivation to work towards cessation. So I do think, again, it's important that's, as a small n, but I still think the idea of, again, meeting young people where they are is critical. So this is the peer support resource that was mentioned through Health Canada. This is called I Quit For Me, which was initially a program that was for smoking cessation that's been just recently revised. So my understanding is that it's been launched, and when you access the information online, it's a very thorough curriculum, which is accessible to everyone. And so again, just speaking to the importance of, if there's a young person who is interested in peer support, this may be appropriate for them. So in summary, asking about vaping and meeting the young person where they are and thinking about where they are developmentally, and then offering as many options as possible to see really what sticks. So what about the amount of nicotine? So I might just pause here. Wondering about what our thoughts are, as Colin reports that he's using 1 pod per day, and each of the pods have, I said, I put the 20 milligram per milliliter, but in fact, for this example, it's 50 milligrams per milliliter. And sorry, not each of the pod, I'm sorry, the concentration is 50 milligrams per milliliter. So just I'm wondering what our thoughts are in terms of the amount of nicotine that Colin may be consuming.
So we've got a couple of answers. Takes 40 milligrams per day, 1 pod, about 40-ish milligrams, 20 milligrams.
And sorry, and that's on my part, I think it's a bit confusing because we do have the 20 milligram per milliliter, so that's correct if you're using those numbers. Great. Okay, so let's talk about estimating the amount of nicotine. When we talk about the amount of nicotine that we estimate, this becomes critical with respect to the amount that we might be thinking about replacing, or what we're thinking about in terms of the degree or the severity of withdrawal symptoms that a young person might experience. The example, as I've outlined it here, was where there was 50 milligrams in a milliliter. And that particular pod has 2 milliliters. So in this example, it would be 100 milligrams per pod. So being able to get to that initial step, I actually do recommend that a young person has the, if possible, that we provide this approach so that they themselves or that they're able to actually complete these steps on their own and figure out how much or estimate how much nicotine, the amount of nicotine that they're consuming per day. And so the second step being looking at that amount per pod in this case. And it looks like Colin has mentioned that he uses 1 pod per day. So in fact, it would be 100 milligrams per day. And then converting that amount to cigarettes per day. So again, this is an estimate. So if it's 100 milligrams per day, then it would be 100 cigarettes per day. And then I often ask about how much a young person pays for their vape product. And I use that as an opportunity to essentially verify if in fact this seems fairly accurate. So if in this case it was 3 pods for $10, for example, and they're spending $20 per week. Well, that's 6 pods per week. So that sounds roughly about 1 pod per day, give or take. But if that seems to be maybe a little bit less than what the teen, adolescent, or youth is spending, then again, it's an opportunity for that dialogue where, is it possible that you're actually using more than the young person thought. So this is just the summary of that calculation in a different format. And maybe I might just pause just for a second to see if there are any questions, because this sometimes can be a bit
Yeah,
Um,
there's one in the chat about, can you say more about the number of milligrams versus how many cigarettes that equates to?
sure. Yeah. Any other questions?
There is another one in the Q&A that was related to this.
So I could start with this question.
Yeah.
So when we have a conversation about the amount of nicotine, it is in the milligram per milliliter on the pack in terms of the packaging. So this is where it becomes a bit tricky. I often find it a lot easier to essentially look up the device or the product that the young person is using. It's rare that they would have the packaging with them, but they may know how much nicotine per milliliter they're consuming. For the most part, it would be 20 milligrams per milliliter or 50 milligrams per milliliter. More and more, we're seeing more of the 20 milligrams per milliliter. And that's because we're seeing more enforcement, I would assume. However, the tricky part about this is the volume. So if it is the closed device, so either the disposable device or the device that that we've just used as a demonstration, which was the pod that has a fixed volume, we would need to know what that volume is. And I need to emphasize that piece because disposable devices can have upwards of over 10 milliliters per product. So if it's the 50 milligram per milliliter amount and you have a disposable device that has 10 milliliters, you could see how significantly different in terms of the amount of nicotine that would be as compared to the pod that we've just used as an example, which had 2 milliliters. So that goes back to the initial discussion where it really is important to know and to have that discussion about what a young person's actually, what the product is that they're using. And that may take a little bit of a bit of searching, whether it be online or a bit more of a discussion with them about how they're using the product, particularly if it's a closed product where they would purchase the liquid separately. With the liquid that's separate, what I typically see is it's usually about 30 milliliters, and then the question is, again, how much of the nicotine, whether it be in this 20 milligrams per milliliter, and then when do they essentially run out of that liquid? So if they used it for a month, it may be roughly about, again, 1 milliliter per day. And essentially that's the way that you would try to calculate and estimate the amount of nicotine. So this is again, that's the calculation, the steps being, just to go back to the question, knowing that milligram amount per milliliter, so essentially the concentration, being aware volume is for the device, so whether it be an open or closed device, and what essentially the volume is per product, and then moving forward with that calculation so that we're aware of how much is within, in this case, we were talking about the amount of nicotine in the pod. From the pod milligram amount, we would have it at least do our best to have an understanding about the number of pods that are consumed over a period of time. And in this case, it was a bit more straightforward because it was a pod per day. So converted to 100 milligrams per day. And again, these are estimates because we're not aware of how much is actually absorbed. That's a much lengthier conversation. But just for the sake of moving forward with understanding how much the young person may potentially be exposed to, 100 milligrams would be converted to 100 cigarettes because it's roughly about 1 milligram per cigarette, again, estimated. So hopefully that helps to answer that question. It's visually, I find really helpful to use, and I tend to defer to this as the Stanford Tobacco Prevention Toolkit. And what I like about it is it just looking at that amount of cigarettes visually. I find that when I'm having a conversation with a young person, not only providing the number, but then also visually providing that representation to be very helpful, and it typically has a significant impact. And it certainly then allows for there to be more of discussion and engagement. This is also very helpful for parents. So if we think about the parent in this particular case, I think it would, again, be helpful for them to have an appreciation or an awareness for the amount of nicotine that in this case, Colin was consuming. So this is 90 cigarettes. In fact, it was 100 per day, but you can see how just visually how alarming that is. So again, hopefully I've answered that question. So I won't delve into too many details around prescribing NRT, and I say that because I think many are aware that this often brings up the discussion about off-label medications. I will say, however, that in pediatrics, we often, more times than not, prescribe medications that are off-label. And where I think the emphasis of the conversation here for the cessation strategies for youth need to incorporate essentially all and multi-pronged approach.
Sorry, Dr. Tulloch, your audio just cut out for a second there. If you're able to maybe restart that slide, that would be wonderful. Thank you.
Oh, so sorry about that.
No,
I'm trying to figure out where I started. Okay. But I basically was trying to essentially state that it's important to consider all approaches and to ensure that we provide as many options for a young person particularly a young person who's treatment seeking, and that pharmacological interventions this is one part of the treatment approach. And hopefully you were able to hear the discussion about the concerns with respect to there being the medications that tend to be off-label, that's typically the case for many medications within the pediatric setting. I will just proceed, and this is really here emphasizing the American Academy of Pediatrics position on the evidence that supports the safety for nicotine replacement therapy. The Canadian Pediatric Society also has a similar information that they provide on their website as well. And really, this is, again, very patient-centered. So I want to make sure that I'm really emphasizing how important it is to think about the young person who is in front of you and provide as many options as possible. CANH, we've worked towards providing vaping cessation guidance, and so there is a resource that's available. This resource does target young people ages 15 and older, so just to highlight that, but there is information about approaches, and the emphasis really for youth is the combination of behavioral strategies, and really emphasizing that the behavioral strategies are essentially the first line, and if indicated, again, to consider pharmacotherapy or pharmacological interventions. And so as I'm nearing the end of the content, I'd like to emphasize this concept of a multidisciplinary, multi-pronged approach. as a way of proceeding and addressing the concern that we have, and as we think about the young or teens and adolescents who are presenting with vaping related concerns, and particularly for those who are treatment seeking. So to consider that there may be a comorbid either physical health, mental health condition, and to really ensure that we're allowing for that opportunities. This is clinical.
Dr. Tulloch, it seems like your audio might have cut out for a second there. I'm not sure if you can maybe mute and unmute.
Oh.
Oh, there we go. You're back. All good.
I'm sorry about that. So are you able to hear me now?
Yes, no worries. Thank you.
Okay. So looking at the education portion and ensuring that we're providing information about, in this case, the amount of nicotine, as the example, providing options in terms of therapeutic interventions. We've talked about behavioral interventions, and then we've touched on pharmacological interventions and with respect to the fact that we do know that there is always this concern in terms of medications that are off-label, and that's typically the case for many medications within the pediatric setting. So lastly, I just wanted to point out that the parent in this case, was fairly dismissive about there being that it was nicotine and that it wasn't cannabis, and that nicotine wasn't maybe as much of a concern. And so just that importance about considering the caregivers and offering an environment and support wherever possible, and certainly providing education. We do know that there's lots of evidence that emphasizes caregiver or parental support as a critical protective factor for adolescents, and particularly adolescents who are using substances or have substance use disorders. So in summary, we know that vaping rates are high among Canadian youth. We really need to start we should be thinking about prevention, given that we have enough data that suggests it's much earlier than high school in terms of the onset of their use. To think about cessation strategies in a holistic way, and to really think about what's relevant and accessible to a young person. And lastly, to think about a multi-pronged, developmentally sound approach that's inclusive, and consider all of the possibilities, whether it be peer support, parent and caregiver support, all of the internet-based, app-based approaches, behavioral therapies, and if indicated, pharmacological interventions. And finally, for Colin and for all of the adolescents and young people that we see, really it is critical to engage young people where they are. So to emphasize, as my last point, how important it is to think about a patient-centered approach. And with that, that would be the end of my section here. So thank you.
Great. Thank you, Dr. Tulloch. That was wonderful. There are a lot of questions. So we're going to take a few, and then we're planning on having a break around 12:30. And Dr. Tulloch, maybe you can help answer some of the questions that we don't get to. There are a lot that were related to the dosing and the milligrams and the milliliters. And so maybe we'll save those because I think you've answered some of them.
Okay.
Here, I can start asking you some. So we have a question about, is there any research on oral health due to vaping?
So there is, and the challenge that I found in terms of trying to consolidate that data is that there didn't appear to be much consensus. But to answer the question directly, there certainly is data about oral health and the concerns in terms of the implications of that. The flavors in particular, the effect on the enamel, and just in general, the oral health that's compromised as a result of ongoing exposure.
Okay. This is not really a question. I'm not sure well, the comment is she would like to have more information on the dual coil vapes. Not sure what kind of information the person's looking for, but maybe we'll go on to the next one. Would it be wrong to say that the only differences between smoking tobacco and vaping is the removal of 6 out of the 7,000 additives and 40 out of the 50 carcinogens in a cigarette? Brain cognitive functions, neurological and physical harms are basically the same.
It's a really interesting question timing wise, because there was a paper that has just been recently published. It's a group from Tokyo, and they used artificial intelligence to predict future outcomes related to the numerous toxicants that are found within the e-liquid. And essentially the conversation was that, or the discussion was specifically looking at introducing the risk of new and unknown potential health-related outcomes to a population who is not naive to nicotine, or in this case, sorry, the e-liquid and the nicotine. So I would say that we don't have a lot of information. Not that we don't have enough information, I think, to really look at, or to really be certain about what the implications are in terms of the physical health outcomes related to the e-liquid that our young people are being exposed to on initiation of vaping. So hopefully that answers the question without a definite answer, but maybe just to say that, you know, we're really not certain at this time.
So let's see, is the readiness ruler a resource that is accessible to all? I think so. I know it's freely accessible. I know if that's the question that the person's asking. Okay. Will you comment about peer influences, including obtaining vape products?
Yeah, number one. Without a doubt, that is definitively where I think majority of our adolescents are acquiring their first vape device, or when they're first initiating, is in a social context.
Do you know if This Is Quitting is accessible to Canadians? I did a quick search but couldn't find anything.
Yeah, I have tried in the past, and I know, and I've actually called them, and what I've understood is it wasn't available. Now I think it's always worth trying, but my understanding was that it was only available to those across the US.
Yeah. Okay. All right. And Crush the Crave was originally developed for smoking cessation. Has it been adapted for vaping yet?
Yeah. So I don't have the data on that. It's a good question. I thought it had, and now I'm second guessing myself now.
I don't know if this is an answer. Somebody in the chat put yes, it can be for dual use.
I'm second guessing myself there. Thank you, whoever answered that.
Okay. How aware are youth about quit supports for those who vape and want to quit?
I don't think a lot of the young people are aware, because I think most of the time they're not asking. So unless there's an open dialogue, I don't think and I think the data really supports this, is that they often do not know what resources are out there in terms of thinking about cessation or addressing cessation.
Okay. Okay, so I'm just kind of looking to see, what would you recommend as NRT to a 15-year-old that vapes 50 milligrams of nicotine per day?
So again, I'd say that this really depends on the patient and the context. So I would really emphasize the importance of that assessment and understanding contextually what is at play for the young person. There may be comorbidity with respect to ADHD, for example. I could think of a number of scenarios where if it isn't exclusive nicotine use in the context of vaping, there would be a number of variables that we'd need to consider. And it also may be that a young person might not be interested in NRT. So if it was, if we're looking at 15, thinking about the estimate, I'd still start with the assessment and to see where the patient is.
Okay. Oh boy. Others have asked this above, but can Dr. Tolick talk about how much nicotine is being absorbed by the vaping? Since cigarettes have 10 plus milligrams of nicotine, but only 1 to 1.5 milligrams is absorbed. Does vaping 1 pod per day, example 100 milligrams, does that mean they are absorbing that 100 milligrams in a day? It's a bit of a
Yeah, and that question comes up often. I think
yeah.
Many would agree that it's unlikely that it's 100 milligrams per day. And we do that estimate with the understanding that there's so many variables. Depends on the device they're using. There's a number of things that we'd have to consider. So if you were thinking about incorporating nicotine replacement therapy, what you can do, or there are essentially two approaches, and that's actually outlined in the vaping, some of the vaping resources within the CAMH, on the CAMH website. But you could look at the idea of treatment and also thinking about it from a diagnostic perspective. So you're providing NRT and you're looking at whether those symptoms are resolving, and you're following up frequently in order to see that you're seeing some improvement in terms of the inability or the cessation. So the short answer is that it's hard to tell what's actually being absorbed. And I don't think we have a definitive answer. I don't think we would have a definitive answer for every device unless you were testing and getting a level that would actually be in keeping and consistent with the nicotine levels that we would be thinking about in terms of replacing with NRT in this case.
Okay. So the person clarified their question about dual coil vapes. Can you talk about dual coil vapes in regards of higher addiction to nicotine and burned tongue? I have been seeing this.
Sorry, just the last part, higher addiction to nicotine
and burned tongue. Somebody burning their tongue, I guess.
I have to say that I haven't. I'm not familiar with that. So I don't think I could speak to that specifically.
Okay.
Yeah, and maybe it's something that we could follow up on potentially, but I don't think I have much I could add to that.
Okay. Let's see. Does the absorption of nicotine depend on the heating temperature of the device?
And there's a lot, it's interesting, there's a lot of questions about thinking about absorption of nicotine.
Yeah.
And maybe just to maybe help with answering this question about how much nicotine is actually being absorbed. At the end of the day, the best way to ascertain is it's the symptom report. You can use, and they do use cotinine levels. I imagine it's not something that's going to be easy to acquire. It depends on where a young person is or where the patient is, but it really is about the symptom report and to use it. It's a clinical assessment. So I'm not sure about maybe the clinical relevance or the implications as they relate to essentially the absorption, the amount of nicotine, the device, all of those things. Really, at the end of the day, it's about the patient.
Okay. Let's see. Yeah, there's a lot on the absorption stuff. I'm going to leave those and maybe we can answer those separately afterwards.
There is literature on some more of the studies that have been done from the standpoint of assays. Like there certainly are some studies that look at that comparison of the device, and they've taken samples and they've compared. At the question that's come up though is, does that have implications in terms of your practice? So this is because you're always seeing a change in terms of which device is being used. This is it's quite a dynamic sorry. This is the vaping devices are dynamic in terms of which ones a patient might actually acquire. So it's always changing. So that's the challenge with this, and I think the challenge with substance use in general. They're always looking for something new.
Yeah.
We haven't even talked about pouches yet. In fact,
There's a question on that. We'll come to it. Before we come to the pouches, how do you navigate the conversation of cigarettes versus vaping with youth? I.e., sharing that there's more nicotine in vaping might encourage you to turn to cigarette use instead. Would it be better for a youth to be smoking cigarettes or vapes, the lesser of the two evils, in regards to health effects and brain development?
Oh, wow, that's a great question. And it certainly comes up. So I was just thinking about where we tend to see this. I would say more times than not, what I have seen is a young person who's smoking and who is now vaping and prefers to vape because of their concern related to the health implications. And in fact, now just bringing up the pouch discussion, that's another example where it's been smoking, the vaping, and now shifting to the pouch, for example. So I think it's a discussion. I would tend to think about where are we reducing. It's a relative harm discussion.
Mm-hmm.
So if I think that there's more risk in terms of, in this case, and I think most of the time it typically is with smoking, I would be having a discussion about that relative risk and encouraging the young person to decrease their risk and essentially reduce the harms related to smoking.
And I mean, I think it kind of addresses this question about the pouches. You know, how should we approach nicotine pouches when it comes to youth? What is the message to youth who don't smoke or vape, and how may that differ to the message for youth who do vape and want to quit or reduce?
So if you haven't been exposed to nicotine, that's the message, is that there are health implications as a result of being exposed to nicotine. And we can talk about the risks. So I think that's the first part of the message. I think the difference here in terms of the discussion related to pouches really has to do with if this is a discussion about cessation. And I think, again, it's still it's a bit of a slippery slope in essence. Even just the conversation about nicotine in the context of cessation. It would be ideal if we had a non-nicotine approach. When we were thinking about interventions related to vaping and cessation. So again, I think if you're having that dialogue, ensuring that you're really focused on harm reduction.
Okay. Can you talk about how vaping is used compared to smoking a cigarette? Vapers tend to use a device on an ongoing basis throughout the day. Any implications on nicotine addiction and levels versus smoking?
Well, and definitively, and we know that the amount of nicotine that they're consuming and the frequency, that we're certainly more concerned about the addictive nature of nicotine and the much higher risk of an earlier onset of addiction for those who are vaping relative to those who are smoking.
Okay. Do you find that users are shocked about their use when you translate it to cigarettes per day?
Yes, and I would say that that's one of the most effective interventions, anecdotally.
Okay. Okay, let's see. Oh, lots of calculation ones.
Would it be helpful if maybe I could pull up that slide actually and just see if that, so I have that, I have the calculation, but I also have that table. Sometimes just looking at that is to clarify.
While you're doing that, there's one. Most youth are using flavored pods, which is considered unregulated. Is this correct? There are some answers here, actually. Ontario allows sales of nicotine over 20 milligrams or with flavors other than tobacco, menthol, or mint, only in specialty vape shops. How would you know the vape is from a specialty vape shop and not from an unregulated market?
I asked the question. And typically I would say more times than not, they're forthcoming about that. So, and usually if it's 50 milligrams, I'm asking, oh, that's interesting. I tell me more about that. Usually I only see 20 milligrams, and it just sparks a conversation. And then we start to talk about how they're able to acquire it.
Okay. Okay, I'm just gonna go through some of these. Do we know how many milliliters are in the 10,000 puff disposables? I think you answered this.
And it could be it could be variable. That's why it's really important to know the name of the device and to actually look up, like, if possible, the packaging, because there are a number of disposables that are 10,000 puffs. So that's really the only way that I'm familiar with, is I really just look at the device online in this case, or if the young person if they have their device and we take a look at it.
Where did the concentration of 50 milligrams per milliliter in the case come from?
Oh, yes. So the packaging was 20 milligrams. I was actually using 50 milligrams just for this purpose of the calculation and to also show that depiction in terms of the amount of cigarettes. But that's correct. The packaging did say on the example that when we started, it did say 20 milligrams. So if you picked up on that, that is accurate.
Okay. There are many medications, that many medications are used off-label in pediatric populations. Is that what you meant?
Yes.
Okay.
Mm-hmm.
Can you speak to the common sense stance that NRT is better than vaping or smoking, and that the reality that youth younger than 15 years of age are in need of cessation support beyond behavioral interventions?
It's a tricky question. I do agree that it should be, and I mentioned this multi-pronged approach. That's I really think that's a critical part of that treatment plan. But I think it's difficult to state definitively that it needs to be pharmacological in terms of an intervention. And I certainly would encourage that if there needs to be, and there's an indication, and particularly if we're thinking about severity, and that paper that that I've alluded to, we certainly have pointed to that exact point, that a moderate to severe scenario with respect to nicotine use, that we would be considering pharmacological interventions. So hopefully that helps to provide some clarity there.
Okay. Does vaping nicotine cause erectile dysfunction in much younger men?
That's an interesting question. I have not seen that clinically. And again, when we think about adolescents, I think these are, all of these parts around the history and asking about symptoms. It's important to do so because they oftentimes won't be as forthcoming. So I think that highlights just in general the importance of ensuring that we're asking questions about their overall physical health status. But I can't say clinically that I've seen that.
Is teen utilization impacted by context and time of year? For example, is there greater use at school, on weekends, during summer vacation?
We can certainly correlate use with social settings. I think anecdotally we see use does over weekends, yes, and the summer. So the social context does matter.
Can you please comment on the use of the term addiction? Addiction, dependence, substance use disorder are often used interchangeably in conversations.
So often when we use the term addiction, it is all encompassing in terms of substances as well as behavioral addictions. When we are talking about substance use disorders, it is within the overall overarching, again, addiction umbrella, and it is from a North American perspective, the DSM-5 criteria are met in order for the patient to have a diagnosis that is in keeping with a substance use disorder.
Okay. So e-cigarettes, liquid, cartridges, pods in Canada are subject to federal and provincial restrictions, but manufacturers of e-liquid are not required to provide a list of ingredients or quantities of ingredients on their products. For example, products labeled nicotine-free have actually been found to contain nicotine when tested. Can you speak to this?
Again, I think that goes back to that question about how much we're testing the products, and clinically, I know that we may do this in an acute setting if we're really concerned and we're not sure what a young person's been exposed to. But that's again, it's really dependent on the clinical picture, and it's certainly not something that's done for every patient.
Okay. So we're at 12:29. I know there's like over 20 questions left, but I think Dr. Tulloch, if you've got a few minutes, we can go through them and answer them online. But we should take a 10-minute break, and then we'll come back and Les Hagan will talk more about policies in the second half of today's webinar. So it's 12:30. If we can come back at 12:40, that would be great. Welcome back, everyone. So Dr. Tulloch is still busy trying to answer all the questions, and she will continue to do that. But in the meantime, we'll get started with the second half of our presentation. So I want to welcome Les Hagan. Like I said before the break, he's going to talk more about the policy side of this issue. So Les, take it away.
Good stuff. Well, thanks, Rosa, and welcome back, everyone. Almost everyone. A little bit of a dropout rate, but I won't take it personally. And many thanks to CPHA for putting on this webinar series. It's a very important topic. And to you, Rosa and Kelsey and Alexia, this is really, really appreciated. So Dr. Tulloch provided a very good overview of this issue from a clinical individual perspective. And today I'm going to talk more about the social and policy implications of youth vaping. So let's see if I can pass the first test by sharing my screen. Okay, great. How's that, Rosa?
Looks good.
Okay, let's go. So I struggled with the title because we could call it a lot of things, but I would say it's very it's very appropriate to call it a dilemma, a public health dilemma we're facing with youth vaping in Canada and in other countries. But I'll start off by giving you some background on ASH. The organization was founded in Edmonton in 1979, and we are one of Canada's leading tobacco control organizations. And over the years, we've provided local, provincial, national, and even global leadership on tobacco control. And our strategies include public awareness, primarily through publicity strategies, community mobilization, meaning engaging with the public, with other health organizations, and people even who are beyond public health on this issue, working beyond public health. And of course, policy development is central to what we do. We're a small organization, so it's about bang for the buck. And public policy is really where it's at. If you're trying to achieve a lot of reach without a lot of resources available. And then in recent years, we've taken on more of a knowledge transfer role as well, and moving all this research and knowledge into action. And it should actually say knowledge to action, not knowledge transfer. So I got to correct that this slide. And prevention's our top priority, keeping kids out of the tobacco market, keeping kids away from nicotine, preventing the problem in the first place. We have and we continue to support smoking cessation efforts, though, and strategies to help people quit, and an evidence-based approach to tobacco reduction overall. So I'm gonna break all the rules today, and I'm gonna give you my last slide first. And you're gonna see this at the end too, just so you remember. Here's the solution to the whole problem we're talking about. And it's very simple. It's just about aligning our highly successful public policy measures on smoking and tobacco use with our restrictions on vaping to the greatest extent possible. We need to level those up. We need to bring our vaping regulations in line with our tobacco regulations and policies. Generally speaking, there are some exceptions to that rule. There are some fundamental differences between cigarettes and vaping devices, so we have to take those into account. But why mess with success? We've got the lowest smoking rates on record. We didn't get there by accident. There's been a lot of blood and sweat and tears. We've had to fight a really nasty industry along the way over the decades. And look what we have achieved as a society. It's remarkable, and we should all celebrate. This is no small thing, especially if you look at other public health and addiction issues, right? Everything else is trending in the opposite direction, whether it's obesity or physical activity or other forms of substance use. We really need to celebrate the success we've achieved on tobacco use, and we need to protect our gains. And that's really what is really the crux of this issue on youth vaping. So here's a warning. I'm going to be making a bunch of random and bold statements today, just to keep things interesting. Things that need to be said and often aren't. Those are the things I'll be raising. And hopefully that stimulates some discussion and dialogue. And I welcome your questions. And I invite your questions, and you better have some questions. So let's get started right at the ground zero here. Tobacco, what's the big deal? Well, it's the leading avoidable cause of illness, disability, and premature death in this country and in the industrial world. And developing countries are quickly catching up. It, of course, has an enormous impact on our quality of life, our economy, and our healthcare system. And our quality of life goes beyond health outcomes. Our quality of life includes productivity. It includes the ability to participate in society. It includes the ability to fulfill our human potential, right? It goes above and beyond just being healthy. But if we're going to put numbers on it, the last estimate by the Canadian Centre on Substance Use and Addiction was 11.2 billion annually in 2020. Less than half of that, believe it or not, was healthcare costs. And does anyone know? We can throw this in the chat. Does anyone know what the biggest cost impact is of tobacco use in Canada? I better look at my chat here.
If you
Someone
can't,
said absenteeism. Well, you know, you're in the ballpark. You're in the ballpark. The biggest impact is on employers. And that includes sick leave, absenteeism, long-term, short-term disability, healthcare costs paid for by employers, employer healthcare plans. So that adds up, and that adds up to more than governments are spending on treatment costs. So every employers across this country are feeling the pain of tobacco use on a daily basis. And of course, non-smokers are also affected. So there are people who are caught, people who aren't directly involved who are caught up in all of this too. Trying to go to my next slide here. It can't be that hard. There we go. And tobacco is a uniquely deadly product. There's no safe level of consumption. Every cigarette is harmful. We know that nicotine is highly addictive, no matter what format it comes in, including vaping products. It's the most widespread and deadly form of substance misuse in Canada. In fact, it kills more Canadians than all other forms of substance misuse combined. And it's the only substance, this is the clincher here, the only substance that kills 1/2 of its users when used as intended. But there's a lot of dangerous products out there, but their intended use is often different than their actual use. With cigarettes, there's only one way to use them, and it's a harmful way and a deadly way. So we're going to transition. I'm going to bring you to youth vaping, but let's talk about youth and tobacco first. And we know that 80% of smokers are addicted by the age of 18. So it's largely a pediatric illness, a tobacco addiction or tobacco dependency. We have, last count, 43,000 school-age smokers in Canada, according to the Canadian Student and Tobacco, Alcohol and Drug Survey, which is at least sponsored by Health Canada. And that's 2% of youth in grades 7 to 12 and 7% of youth who are age 16 to 19, right? So as you go older, the rates go up, but they're a hell of a lot lower than they were 20 years ago. That said, we continue to struggle, and youth vaping is part of that struggle, and the tobacco industry is part of that struggle. And the tobacco industry continues to target kids with price discounts, with smoking depictions on film, with various types of social media promotions. Sometimes they're not very obvious, but they are still very deliberate, including paying off influencers. And then we have continuing bar, club, and event promotions, and kids and young adults see this stuff. So I want to just quickly compare the dependency levels of different substances. And, look, you can see where nicotine is at, right? Like about 2/3 of people who use nicotine or use tobacco products are hooked on nicotine, 2/3. Now, if we look at alcohol, it's about 1 in 5 people who use alcohol who are clinically dependent on alcohol. And it's about the same with cocaine. And with cannabis, there's a lot of concern about cannabis. But THC, less than 10% of people who use THC are clinically dependent on THC. So, let's keep all of this in perspective here. And it just demonstrates how terribly addictive nicotine is. And this slide shows mortality from tobacco and cannabis. Again, we hear a lot about, oh, you know, cannabis is a big problem. We got to keep our kids off of cannabis. I'd rather see my kid vaping than using cannabis. Well, you know, here's the mortality rate for tobacco and cannabis in 2020. Tobacco kills more than 100 times more Canadians than cannabis. And by the way, this was impaired driving included. So this is from the Canadian Centre for Substance Use and Addiction. They're one of our leading national authorities. They've done the math, you know. And hey, look, let's say their estimates are off by 2 or even 3. Well, that would mean that we would still have less than 1,000 people using or dying from cannabis annually, right? So there's just no comparison. Now let's start talking about youth vaping. But before we do, maybe we could throw a couple of questions out just to keep this really engaging. Alexi or Kelsey, can we throw a couple of those questions out? Okay, here we go. The first one, what is the primary illness resulting from smoking and vaping? I like that it's live. This is really cool. Okay. Well, most of you are getting it right. Yes, nicotine addiction is an illness. It is an illness, and it even has its own disease code, right? Like, and doctors can bill, like Dr. Tulloch can bill for nicotine addiction, because it is an illness, and it's the worst kind of illness because there's a physiological element to addiction, but there's also a psychosocial element to addiction. And the physical part of it, the physiological part of nicotine addiction, you can usually deal with that within the first 2 to 3 weeks of vaping, or first week or two of quitting. That's usually dealt with. What sticks is the psychosocial part of the addiction, the mental part. That's the toughest part for most people. Okay, so there's one, and I'll just carry on here. Thanks, guys. So youth vaping, what's the big deal? Well, the fundamental illness associated with smoking is the fundamental illness associated with vaping. It's the same. It's nicotine addiction. They have the same fundamental illness results from the use of both products. We know that youth vaping can lead to the possible renormalization of smoking. The more of this people see in public, the more puffing, doesn't matter what it is, whether it's a vape or a hookah or a cigar, you know, or a fatty, you know, like a cannabis, a joint. It doesn't matter. You know, to a 5-year-old, it's all smoking. And the more smoking cues that 5-year-old receives, as they develop, the more likely they are to become smokers themselves. And if they're not distinguishing between all of these products, and you know, from a distance, I can't tell. So how can a 5-year-old tell? If you're not distinguishing, then you know it's going to cue you up for smoking or set you up or increase your odds. As we know, there are a lot of regulatory inconsistencies between tobacco and vaping products, and I'm going to be drilling down into that. We'll do a deep dive on that. And of course, numerous health risks. But if the only health risk from vaping was nicotine addiction, that would be enough to act. That would be plenty. We don't need to wait for another study. We know that nicotine vaping products contain nicotine. We know that kids shouldn't be using nicotine. We have textbooks written about nicotine addiction. We have thousands of studies and probably hundreds of review articles and monographs and such on the risks of nicotine addiction. Like it's a fact. Nicotine is addictive. Nicotine is harmful. Nicotine is poisonous. when it's used in higher concentrations. We know all of that. That's enough to act. Don't wait for a study, the next study on vaping. There's no need to wait. Okay, and here's the scope of the problem in Canada. 360,000 youth in grades 7 to 12 have vaped in the past 30 days and are risking nicotine addiction as we speak. This was 2022. Hopefully it's a little lower now. That said, this number was pretty much unchanged. Health Canada calls it unchanged from pre-pandemic levels. So we're in 2022, we're still at sky high soaring levels of youth vaping in Canada. And all of those measures we took up to 2022 haven't had much impact because we haven't taken enough of them, and we haven't aligned with our highly successful regulatory package to address tobacco use. And we continue to have this patchwork of legislation and regulation across the country. And we know that flavored vaping products are rampant. And we know that the industry is continuing to develop new products that appeal to kids. And the latest are disposables, right? And kids are vaping them like crazy. And some of these disposables deliver up to 30,000 doses of nicotine. Okay, here's a random bold statement. Tobacco control is harm reduction. Now, you've heard a lot of people say, well, vaping is harm reduction. We got to use vaping to reduce the harm of smoking. It's better to have people vaping than smoking, right? But tobacco control is a harm reduction strategy. I can't think of a more effective way of reducing drug use in Canada than by focusing on the most harmful drug, right? And, it's not just about reducing, it's about preventing kids from starting. And that is harm reduction. And, every time we increase taxes, not only does it keep kids from starting or introduce more smoking restrictions or more marketing restrictions or health warnings on cigarette sticks, whenever we do these things, they have multiple effects. And one is they encourage smokers to quit and cut down, right? And by cutting down, smokers are more likely to quit in the future. And then they also help to keep kids out of the market. So these policy measures have multiple effects. Write this one down. Tobacco, keep this one in mind. The next time you're in a discussion about the importance of NRT or the importance of vaping for harm reduction, tobacco control is the best form of harm reduction. Now, there's a big debate about vaping. Is it harmful? Is it harmful? Well, I think this 14-year-old boy from Lethbridge who suffered second-degree burns from vaping, I think he would tell you vaping is harmful. I'll let you come to your own conclusion. It looks pretty harmful to me. Fortunately, this kid had his glasses on when the vaping device exploded in his face, or he may have lost his eyesight. So yeah, vaping's harmful. I stress the importance of nicotine addiction. And if that was the only problem with vaping, the only health risk, that would be plenty to act. Well, here's the other implication of that. Youth who vape are 2 to 3 times more likely to start smoking. So it's a big risk factor for smoking. We don't want kids smoking. We don't want to reverse our decades worth of success in driving youth smoking rates down to record low levels. Why would we want to mess with that? It wasn't easy. For those of us who've been in the game for a while, it was a lot of blood and sweat and tears. It wasn't easy. We've got wounds. Why would we? It's ridiculous. We can't let this happen for any reason. And certainly not for the sake of opening up the market for vaping. Now, I can't talk about vaping without talking about Juul, because we didn't have much of a youth vaping problem until Juul came along, which kind of the ultimate marriage between a vaping device and an iPhone, taking something not so interesting and making it like high tech and sexy and easy to hide. It's easy to conceal. It looks like a USB stick. How cool is that? So it's really kind of the ultimate form of it was a design genius who developed this product. And sadly, kids gravitated to this product en masse. And this is a big Time magazine cover story from January 2019, talking about Juul's role in effectively starting the youth vaping epidemic by taking this rather uninteresting e-cigarette and turning it into something sexy and appealing. Oh, by the way, with extremely high doses of nicotine and a new format of nicotine called nicotine salts, which lowers the pH level so it's easier to absorb, right? And because of that, the dosing is higher. So Juul has factored into this discussion in a very significant way. Now, Dr. Tulloch showed you some data, and here's some more. This is the trend since we started measuring youth vaping in Canada. And as part of the Canadian Student Tobacco, Alcohol, and Drug Survey, we started in 2014. And at that point in time, only 6% of youth in grades 7 to 12 were vaping, had vaped in the last 30 days. That jumped up a little in 2016, 2017, as some of the products started showing up. Juul did start showing up in late 2017. And then the big increase in 2018, 2019. And there were a couple of things at play, not only Juul, but this is the same year that Canada legalized nicotine vaping products and legalized them with very few restrictions at the time that have subsequently been a number of regulations that were overlooked at that time or that were deemed as unnecessary have been brought into play, fortunately, but we're still lacking on the regulatory side, and I'll be going through that. And then it looks like we've gone down a little after the pandemic, right? But statistically speaking, Health Canada says that the number is unchanged because of sampling errors and whatnot, right? So at present, that number in 2019 was just over 400,000. The number today is about 360,000. Oh yeah, here are the numbers. So that's discouraging. We would have hoped that the pandemic would have had some impact. The kids are all going home from school, and they're not around their peers. So that would have been I was certainly hoping that we would see significantly lower levels of youth vaping after the pandemic, but that didn't happen. It's another bold statement. Nicotine vaping is just another form of nicotine replacement therapy. Yes, I mean, there's nothing magical about a vaping device. It's just another form of nicotine replacement. You're just breathing in nicotine, just like the inhaler, just like the nasal spray. You're just breathing it in and it's absorbed into your airways. And, that's how nicotine ends up in your bloodstream. There's no magic to it. And in my mind, there's no need to build a national tobacco reduction strategy around a single mode of NRT delivery. It's silly. Getting back to Juul for a minute. So Juul was held accountable for its role in the youth vaping epidemic. There have been multiple lawsuits by municipalities, school boards, and states. And this was the big state settlement in late 2022. The settlement was for 440 million US, so about 4 billion Canadian. Right. But big settlement. And, Juul is no longer the name of the game in youth vaping. It's still out there, but, they've had to alter their game plan a little because of all these legal rulings and settlements. So now I'm going to share some more data with you, and this is from David Hammond's work at University of Waterloo. And this compares Canadian vaping and smoking rates with rates in the UK and the US. So you can see how Canada compares with our peers or other countries. And in terms of vaping in the past 30 days, you can see that we're relatively in the middle here. Now, New Zealand was just included in this survey in 2023. So these trend lines are for Canada, England, and the US. And you can see Canada's roughly in the middle, the US is lower, and the UK is higher. And we're looking at smoking. Sorry. But our smoking rates are at an all-time low in Canada and the US, our youth smoking rates, right? So we've made substantial progress. That said, things are also level. So, we want to keep that going down to zero. That's what we're after. And, I think that one of the reasons why it's not at zero or closer to zero is because of the youth vaping problem. And here is vaping in the past 30 days in all 3 countries. And you can see that Canada and the US are pretty much on par, and England is much higher. And England is really, since 2021, you can see before 2021, England was behind Canada and the US because when they legalized vaping, they did bring in some restrictions on promotion and advertising, but the vaping and tobacco companies ultimately found a way around that and then came out with disposables as well. And those have really taken off in the UK. In Canada, and this is ages 16 to 19. So this is an older sample than the one I just showed you, which was grade 7 to 12. In Canada, all I can say is the problem persists, right? And it may have come down a little among this age group since 2020, but not in any dramatic or encouraging fashion. And the line seems to be leveling, and that's discouraging. Okay, and now this is the type of vaping device that youth are using in Canada and the trend. And you can see how that has changed. And when Juul came along, we had the cartridges take off, right? And that was back in 2018, as mentioned. And that took off, and that was the majority of the youth market for a long time. But within recent years, disposables like the Elf bar and the Puff bar and others like it have taken off in a big way. And the cartridges are going down in use. And then things like refillables and open nicotine products are under 20% use among this age group. So it's getting to be about disposables. By the way, the UK is banning disposables, and multiple countries have banned disposables. So hopefully Canada can get after that quickly. And then this is that same age group for Canada. It's all the age groups for Canada over time since 2013. Including the 15 to 19-year-old crowd. And you can see that vaping is concentrated among youth, teens, and young adults. That's where the problem is, right? That the rates among people over the age of 25 haven't changed that much over the years. So it really is a youth problem. And this is a telling slide. This is from Physicians for Smoke-Free Canada. And based on the tobacco and nicotine survey. And you can see that the number of vapors who are former smokers, in other words, the vapors who are actually using nicotine vaping to quit smoking, that's that's only 1/4 of total users. Only 1/4 of total vapors in Canada are actually using vaping products as intended to quit smoking. 38% are using both products, are smoking and vaping. And another 1/3 are never smokers. So these are just recreational, never smokers, think that vaping is cool and decided to take it up. And, you know, a lot of these are young adults, as the previous slide tells us, right? So it's become the cool thing, and it's sad. And then the bottom slide breaks the numbers down even further. But it's very telling where the problem lies. It lies among young people, including young adults and teens. And it's a recreational use problem. It's not being used as we want it to be used. Here's another bold statement. Nicotine vaping disperses aerosol droplets, not nicotine vapor. Vapor is gas. Gas is usually invisible. You know, we're breathing water vapor right now. You can't see it. We're breathing nitrogen vapor right now, but you can't see it, right? Like what you see coming out of a vaping device is not vapor. You're seeing droplets. And the difference between droplets and vapor is that those droplets end up getting dispersed on your upper airways, your throat, and your mouth, not unlike nicotine inhalers, not unlike nicotine sprays. With cigarettes, we call that freebase delivery of nicotine because it actually does the heat of a cigarette actually turns the nicotine into a gas. That gas goes way deep down into your lungs, into your alveoli, which are like the leaves on a tree. You know, if you think of your lung as a tree, the leaves are where the alveoli, that's where the gas exchange happens, right? On a tree, you're exchanging carbon dioxide, which is another invisible gas we're all breathing right now. And the tree is turning that into oxygen for the other life forms on the planet like humans can live, right? That's what a tree does. And a lung and the alveoli in your lungs are taking that gas, whatever gas gets down there, and feeding it to your bloodstream, right? So cigarette smoking is freebasing, basically what they call freebasing nicotine, whereas vaping is aerosol distribution. So the aerosol with a vaping device is smaller than an inhaler because it's heated. So you do get better dispersion, but it's not vaping. Like vaping is a marketing term. It's aerosol distribution, which doesn't sound as sexy, right? Now, here's the patchwork quilt that we call Canada's policy response to vaping. And it's a mess. And it's Swiss cheese, right? Like you can drive a train through this. And if we were able to combine all of these elements into one tight national law, we'd be getting somewhere. And we have taken significant steps, but they are reactive steps to the problem that already exists, right? We should be taking some steps to actually prevent it from getting worse. And one such step is taxation. Taxation is the single most effective means of reducing tobacco use. But we're only now, several years later, getting around to taxing vaping products. That should have been the first measure, not the last. And then we could use better warning systems. We could use plain packaging. We have plain packaging for cannabis. And for tobacco, we could have plain packaging for vaping products. We could have bolder health warnings, graphic health warnings, especially when it comes to youth. How about, here's a health warning. This product can increase the risk of smoking. That would be a nice warning. That would be very factual. There's lots of evidence to support that. I'm getting some thumbs up on that one, right? We could further explore that. And more restrictions on marketing and advertising and promotion, including social media. Thanks, guys. Yeah, hey, social media, that's become the new medium, right? And we got to get after this. On several occasions, I've asked Health Canada, why don't you just sit down and talk to the major social media providers? Whether it's Meta or X or Google, just sit down and talk to them. Schedule a meeting, go see them and tell them, please help us to keep vaping products out of the hands of kids, right? That would be a good start. And then we could use better legislation as well. And without getting into the nitty gritty, what the simple answer is, just a line. Our very, very excellent laws on tobacco, get those lined up with restrictions on vaping and vaping products. So, here is some of the progress we've made on a policy, from a policy perspective on youth vaping. But, I've got a question mark there because these are all reactive steps. We've taken these in reaction to the problem rather than preventing the problem. And we had an opportunity to prevent the problem, and I'm going to be talking about that. So, we've banned confectionery flavors. So now instead of banana split, you can only have banana, right? Instead of strawberry shortcake, you can only have strawberry. Well, I'm sure that makes a little bit of difference, but not a lot, right? Why have flavors to begin with? And why wouldn't we learn from our success on tobacco? We banned flavors on tobacco and then we kept menthol. But a lot of us said, well, why keep menthol? That's not cool. The kids love menthol. And the response was, well, not many kids are using menthol. Okay, well, then we got some Health Canada data showing the opposite, that yeah, actually kids are using menthol cigarettes at twice, 2 to 3 times more than adults. And then we finally started getting some provinces to move on banning menthol. And then finally the federal government, I guess, conceded its mistake. The menthol mistake, I call it. Well, looks like we're poised to make another menthol mistake here, sadly. So we've got a ban on sales to minors under 18 nationally. In some provinces, that's 19. In PEI, it's 21. We've got a ban on most forms of promotion and advertising, but internet promotions are still, and depictions are still, and endorsements are still rampant. We got to clamp down on that. We've got a nicotine limit on products, and that's good. But then we have companies offering products with 30,000 doses. So, that's their way of getting around. So we got to stay ahead of this stuff. We got to be thinking 3, 4, 5, 10 years out. We've got to be thinking about how they're going to respond, and then we legislate accordingly. We don't let them do all this stuff and then come back and try to put the horses back in the barn, right? That's bad policy. That's terrible policy. That's irresponsible public policy. And then we're finally getting these taxes, as mentioned, and the feds have agreed to collect, which is great. Provincial taxes, that helps to simplify everything. So, that finally, right? And I do expect that's going to have some impact on youth vaping. And then we've got, the most basic health warning ever devised on nicotine products. Nicotine is highly addictive, duh. Okay, that's it. That's all we have. We could have several. Here's another bold statement. Nicotine dependence is a chronic relapsing illness. Well, when I asked you guys this question, most of you got it right, that it is the fundamental illness associated with vaping and smoking, right? But we got to think of it as an illness. We got to treat it as an illness. It's got its own ICD-9 code, F17.2, and this is how physicians bill when they counsel and offer treatment for nicotine and tobacco dependency. So but it's a relapsing illness too. We gotta, this is what addiction is, right? Like it's about, it's not just about quitting, it's about staying quit and taking away those cues, like public smoking and vaping and the big displays and the advertising. We gotta reduce those cues so that when people quit, they can stay quit, those social cues. Okay, I'm going to go back in time a little bit. How's my time? Okay. We're going to go back to the beginning when Parliament first recognized that youth vaping was spiraling out of control or starting to. And we needed to do something to regulate vaping products. So the Standing Committee on Health came out with this report on a regulatory framework for e-cigarettes. Back in March 2015, and their main conclusion from the report was that yes, we do need a new regulatory framework. Let's add it. Let's include it with the tobacco legislation, which sounded good. Sounded good at the time. Made sense. We've got this great tobacco legislation. Smoking rates are at an all-time low. It's let's add nicotine. Let's include nicotine in the tobacco legislation. Okay, and then 2 years later, the federal government responded with Bill S5 to bring nicotine products into the Tobacco Act, and in fact to rename the Tobacco Act to the Tobacco and Vaping Act. The Tobacco and Vaping Products Act, right? So that was the bill. Now, sadly, the difference between this proposal right here by the Parliamentary Committee on Health and this piece of legislation is that, yeah, it did bring vaping technically into the Tobacco Act. However, it did not line up the regulation between the two products. And that's what we've been reverse engineering for the past 7 years, right? And it's a shame. And in fact, we warned them. We warned them. The health community warned Parliament and the government and Health Canada that if you don't line up your regulatory restrictions on vaping and tobacco, especially as far as promotion and advertising are concerned, we're going to see an explosion of advertising on these products like we have never seen in 46 years since the tobacco company tobacco advertising went off the airways. This was our prediction. And this ad went in the Hill Times, and many presentations were made to senators and parliamentarians, and amendments were proposed that didn't get passed to level up the restrictions on vaping products and tobacco products. It didn't happen. So here's what happened. We had an explosion of marketing, including social media promotions, vaping and cloud competitions, Facebook advertising, film depictions. There's Drake, advertising an event sponsored by a vaping company. Film depictions. This is part of it. Here's more. We actually had tobacco companies advertising on television again for the first time in almost 50 years. Now, this was Imperial Tobacco advertising vape on the airways, prime time. And that went on for, I think, at least a year before that was reined in. And then the endorsements, right? And the influencers. We've seen a lot of that. This stuff continues. Perhaps it's not as it's not branded anymore. This was branded and it was legal under the Act for a number of years. And then we saw the store promotions, right? For a couple of years, we were bombarded with all of this stuff before the provinces finally stepped in and started getting after this, so and in the meantime, the number of youth vapors just continued to swell. And store promotions, look, we had already removed tobacco from countertops and from the power walls. We had done that 10 years earlier, or more, and now it's back, and the nicotine products are back, right by the bubble gum and the chocolate bars, and right in kids' face, right at kids' eye level. This is so ridiculous. Okay. So I want to pause there, and I know we've got a bunch of questions, and I'm prepared to take some questions. Rosa, what do you think? Should we take some questions?
Sure, sounds good. This time I've been trying to keep on top of the questions, so let's see. I've moved them over here. Okay. It would be helpful to classify cigarettes, filters, and vapes e-waste under single-use plastics pollution, ban use of filters in cigarettes, and put an environmental levy on vapes. Your thoughts if these are foreseeable?
Oh, well, I'm glad you mentioned that, because I just came back from the UN Plastics Treaty negotiations in Ottawa at the end of April. It was the fourth round of negotiations, and there's another round coming up at the end of the year in Korea. And so we actually made some progress. There's a global alliance called the Stop Tobacco Pollution Alliance, and Ash Canada is part of that. And we made some progress at the treaty negotiations to help ensure that cigarette filters and disposable vaping products will be included in that treaty, and that the treaty will help to facilitate national bans. So thanks. Good question. We're working on it. Stay tuned.
This is a comment actually just related to what your slide there. A comment was, has Health Canada not learned anything? Allowed introduction of pouches without any or very limited regulations and restrictions. And thanks, Jamil, for pointing out that BC and Quebec are leading the charge with moving these behind the counter in pharmacies. So that was more of a comment. Okay. Practically speaking, why do we keep separating tobacco, cigarettes, and vaping products? Smoking or nicotine use is not down if we consider these together. I guess that's a question. And something similar to that, I'll just kind of ask it and then you can answer the questions. Can you attribute the reduction in smoking to an increase in vaping?
What was the last question? I'm sorry.
Can you attribute a reduction in smoking to an increase in vaping?
Not yet. I have yet to see the review article that draws that conclusion. And smoking was trending down long before vaping became a thing. And we should be very worried about kids and vaping, right? And there are lots of measures we can do to keep kids out of the nicotine market in general. Yeah, it is important to clarify the differences between smoking and vaping. So the fundamental health risk is the same. That's nicotine addiction. However, is vaping killing 46,000 Canadians annually? No. I'm sure the number is much lower than that. But the fact that youth vaping can contribute to smoking initiation is a huge concern, and something that may trip us up over the long term and may be keeping our youth vaping rates level, or our youth smoking rates level right now. Maybe they would be going down even more. But Ash, from my organization, we actually think that vaping, nicotine vaping, is a viable form of nicotine replacement therapy, but it's not a magic bullet. And when you compare it to other types of nicotine replacement therapy, the success rates come in about the same as combination therapy. So if you're taking the patch and an inhaler, that's pretty much about the equivalent impact of nicotine vaping. So, and what other fields of medicine would we celebrate a 10 to 20% success rate, right? Like it's it's kind of discouraging, whether, we know that most smokers who are trying to quit right now are going to fail. That's really, really disheartening. We also know, though, that the more times they try, and if they change it up as they try, like don't keep doing the same thing, learn from your last trial. The more times they try, and Dr. Tulloch, Dr. Selby will tell you this, the more times they try, the more times they're likely to succeed. So we can't give up on people.
Okay. What is your knowledge and experience with alternative to suspension programs used in schools? Have you conversed with partners or clients that have been part of them? And do you have a comment on the implementation and success?
Yeah, and I'm going to be getting into a school board policy a little further on, but I would say this in general, like we should, when it comes to kids, we got to remember nicotine addiction is an illness. So would we punish a kid for having an asthma attack at school? Right? Like asthma is an illness, nicotine addiction is an illness. We got to be compassionate here. So we recommend efforts that are remedial, not punitive, right? And we don't want to be sending kids home from school en masse, or they're going to drop out. And we've got too many kids dropping out of school, and then there's all kinds of things that come with that from a public health perspective down the road. People who don't complete high school have lower health outcomes. We don't need that. We need to keep kids in school, right? So we're doing too many reactionary things on this issue. We got to think ahead. We got to stay one step ahead. Yes, we have to deal with today's situation, but when we're dealing with today's situation, we deal with tomorrow's situation at the same time. So, like the Ontario government, $30 million, $30 million for vape detectors in schools. Well, how reactionary is that? What if you just spent half of that money on youth vaping prevention, and then maybe the other half on detectors? Just saying.
Good point.
Okay.
All right. Do you want to continue with your presentation?
Okay, yeah,
Or
we'll
continue
do.
tracking. Yeah.
Okay, here we go. My next bold statement. Health Canada promotes nicotine vaping for smoking cessation, but has not officially authorized vaping products for this purpose. Now, there are other forms of nicotine replacement that are authorized. And as I mentioned, combination therapy is pretty much, in terms of impact, pretty close to vaping. It's about the same. So, we should have been regulating this from the beginning, before we allowed these things on the market. They should have been, Health Canada could have required these companies to follow the regulatory protocol and introduce them the way that other NRT products are introduced. But instead, we decided to do the Wild West thing and just put the market wide open and then sit back and see what happens. That's not the precautionary principle, Health Canada. So we've had a whole bunch of people weigh in on this subject over the years. And here's a statement just before the pandemic from the Council of Medical Officers of Health. So Dr. Tam and her provincial colleagues across Canada, and they came up with a number of recommendations on vaping. And here they are. And for the federal government, provincial governments, municipal governments, things like banning all flavors, limiting the nicotine content, raising the minimum age to 21, further restrictions on marketing, et cetera, et cetera. Basically, for the most part, aligning the restrictions on vaping with those on tobacco. That's what most of these recommendations would do. And You know, our medical officers of health were nobodies before the pandemic. Today, everybody knows their medical officer of health, right? So these people have more influence than ever, and hopefully they will continue to use their influence to encourage the federal and provincial governments to address youth vaping in a bigger, more meaningful way. Let's talk about the menthol mistake on cigarettes. So back in 2011, the federal government banned all flavors on cigarettes except menthols. And as I mentioned earlier, that we had data come out very shortly thereafter showing that menthol cigarettes were much more popular among youth than adults. And we used that data to ultimately help trigger provincial and federal bans on menthol products. So we've been there, we've done that. We've exempted menthol. It didn't work, right? But it looks like we're going to do it again. Oh, and by the way, the World Health Organization says ban all flavors. The World Health Organization, who oversees our tobacco control treaty, the world's only public health treaty, the Framework Convention on Tobacco Control. And WHO oversees this treaty. WHO is telling all member countries, including Canada, who was an early adopter of the treaty, a formative member, urging Canada, please ban all flavors in vaping products, right? So it's not just coming from advocacy groups like ASH. It's coming from all over. It's coming from health professions, this advice. It's coming from WHO. It's coming from the medical health officers. Ban all flavors. And recently, of course, we've had to deal with some more product innovation on the industry's part. And this is nicotine pouches. These are produced by Imperial Tobacco, Zonic. Their analog is Zyn in the US. They both start with Z. Could that possibly be targeted? Could these products maybe be targeted to Generation Z? Is that a possibility? And you know, all the kids' favorite flavors, right? So now, so now, you know, we're continuing to push on flavors. About I think it's 3 years ago now, Health Canada initially proposed a regulation to restrict flavors on vaping products, and we're still waiting for that. But we are expecting to see something soon, but we're very worried it's not going to include mint and menthol. So we've been doing some advocacy around that as well. And but in response to the Zonic problem, and it's you know, the fact that the product is situated on store counters across Canada and easily accessible to kids and promoted widely, the health minister came forward and said, stay the hell away from our kids, you know, and warned Imperial Tobacco and others to stop marketing these types of nicotine products that are obviously targeted at kids. Well, we congratulate the minister for doing this, but we would also like to encourage the minister to extend those restrictions to all flavored vaping products, not just Zyn or Zonic. Oh, and here's Imperial Tobacco taunting the minister publicly in a newspaper ad, you know, saying that, oh, we're on board. We don't want kids to use these products. Yeah, well, we know the industry's this kind of stuff makes me laugh. I mean, we know the industry's track record on youth smoking, right? Now, but they want us to trust them on youth vaping. It's laughable. It's a good joke. Unfortunately, the punchline isn't so funny, right? Now it also looks like youth smoking may be coming back among youth, right? So is this vaping related? Don't know. But there have been more and more social media promotions around and film depictions around smoking recently in media that are targeted at youth. So we got to be wary. And we've seen this before, by the way. Youth smoking rates went way down in the late 80s and early 90s. And then the Supreme Court struck down the first advertising ban in Canada, the Tobacco Products Control Act. And then the tobacco companies went whole hog on advertising again for a couple of years, and youth smoking rates shot right back up. So we can't sit back. We gotta move when we see this, and we need to move quickly. So lots of questions about schools, and schools are the epicenter of the youth vaping epidemic. And I feel terrible for schools. They got enough things to think about, including delivering a quality education to our kids. And here's another social problem that they're being asked to solve, right? It's society is failing kids, governments are failing kids, right? On when it comes to vaping and smoking. And we shouldn't be we shouldn't be telling schools they have to solve this problem. And but here's how desperate it's getting. And this is actually an old clip, but it's happening now, where we have schools removing washroom doors because so many kids are vaping. Hey, we have lots of schools now putting in vaping smoke alarms so they can detect kids who are vaping, right? These are all punitive kind of measures, and we gotta, every time, when we take a measure like that, it always has to be coupled with some compassion and with some evidence around, okay, what really helps to keep kids away from nicotine. And here's the big Ontario announcement. Yeah, why couldn't half of that money have gone into prevention? This is crazy. So it's political, it's reactive, and it's dumb. So what can school boards do? Well, first and foremost, ensure that all vaping restrictions are aligned with smoking restrictions. And I think most school boards have done that. I think all provinces have done that now. You adopt a gold standard tobacco policy for your school, and you can get that on our website at ash.ca. Make sure that extends to vaping products. Provide effective tobacco prevention education for all grades, and make sure that wherever there's an opportunity in the curriculum to include some tobacco prevention programming, throw it in. And consult with your Ministry of Health and with the Cancer Society and Heart and Stroke, because they do have prevention programs for schools, and Lung Association. Stop smoking supports, that's important. Although I really empathize with Dr. Tulloch and others who work in that business of trying to get kids to change their behavior and to address addictions. That's a tough crowd to work with. Kids have a lot of things to deal with, and they're not fully capable of dealing with many things. Their brains are not fully developed. And when it comes to nicotine and tobacco, one of the reasons their brains aren't fully developed is because they're using those products, and it affects brain development, right? So it's a catch-22. And here's what we can all do, all of us, after this call, after this Zoom call. We can all call our member of parliament. I'm going to do this right after this because I haven't met with him for a year. I'm going to call my member of parliament and I'm going to ask for a meeting. And that meeting may happen quickly, and I may have to wait a few weeks. It doesn't matter. I'm going to meet and I'm going to follow up. And I'm going to have this discussion, and I'm encouraging. How many people do we have? We've got over 300. If we could reach over 300 members of parliament on this issue in the next month, we would be making progress, right? And just tell them we need to do more on youth vaping. We need to align our successful smoking tobacco legislation with rules, with vaping legislation with our successful tobacco legislation. That's all you have to tell them, including, tax increases. And we have some municipal folks on the call here today, and here's what municipalities can do. And what a top of the list: prohibit smoking and vaping in public places frequented by youth. All parks, all recreation spaces, all playgrounds, all sports fields. You know, there's we have some municipalities in Alberta that have banned smoking and vaping on sidewalks, like Banff and Okotoks. You know, and so, you know, you can, I think in Banff and Okotoks, they do have designated spaces, but they are few in number. And they're not out in the open. So we're not modeling tobacco or vaping to kids. Municipalities and provinces can license and regulate vape shops. That's another thing you can do. From an enforcement perspective, conduct regular compliance checks. And if you're doing that, be sure to use underage test shoppers, because that's really the best way of determining whether a retailer is willing to sell to a minor. And then municipal leaders can urge, and school trustees and teachers can urge their members of parliament to do more. You know, a lot of the politicians go to the same events, whether it's the school board trustee or the local municipal councillor or the member of parliament. They all go to the same events, and they can advocate on our behalf as well. Now, in terms of resources, we've got a great policy hub, at least for the 4 Western provinces, but there are resources there for everyone, and including model bylaws and model policies for school boards and background resources, all kinds of good stuff. Just go to ash.ca. If you want to dive really deep into tobacco control, ASH is also working with the Institute for Global Tobacco Control at Johns Hopkins University, and we have created the independent global surveillance system for our tobacco control treaty. And this is super exciting. We're really invested in this. It's a big project, and we're working globally to support better surveillance and reporting and monitoring of the implementation of the tobacco treaty in numerous countries. And we've actually worked with over 30 NGOs, mostly in low and middle income countries, to produce shadow reports that provide a critique and analysis of their country's implementation of the treaty. So, and we're continuing to do that, but it's globalprogresshub.com, lots of good resources there as well. And here's another bold statement. This is my first slide. This is the bottom line. The message hasn't changed. Hopefully now I've given you all the rationale and justification for this statement. But this is job one. Let's get this job done. Once this job is done, then let's explore getting it into pharmacies only. Let's explore age 21. You know, let's explore tobacco-free generation. Let's go there. For the time being, job one is simply to line up our effective tobacco laws with our ineffective vaping laws. Questions? And I think we've got some more survey poll questions as well, Rosa.
Lots of questions, lots. Really good questions too. And let's see how many we can get through in the last 10 minutes. But okay. So is there data to speak to the influx of immigrants who smoke on Canadian smoking cessation, on Canadian smoking rates? In addition to youth vaping, is this a factor preventing Canada from being able to reach zero smoking rates?
So the question is around smoking among immigrants?
Yeah, I guess the question is about, you know, between youth vaping, which then leads to smoking, and then the influx of immigrants who smoke.
Yeah.
You know, a realistic.
Well, I think there is some potential there. I know with immigrants in general, smoking rates are low with the exception of refugees. Because refugees are usually coming from poorer countries and terrible circumstances, and they're more likely to be smoking. So I think, and we've had to take in a lot of refugees, like from various countries, including Ukraine. So that could have some influence, but I haven't seen that data. But we've seen lots of data on youth vaping. Let's get after youth vaping first.
Okay, let's see. How about the country consider banning e-cigarettes, as we experience lots of new products in various forms like nicotine pouches, and tobacco companies are using the loophole to get into the market for getting youth addicted. These are best practices from other countries.
So someone's proposing a ban on vaping products. Well, several countries have banned vaping products, but it's not something that our organization supports. We see vaping products as a legitimate form of NRT, but they need to be properly regulated and vetted, and that hasn't happened. But we do need to provide help for smokers to quit, and nicotine replacement is a proven form of therapy to help smokers quit. It's not the only form, and it's not often effective on its own. It should be combined with counseling, but we should not throw out nicotine replacement because vaping products came along. Instead, we should clamp down on vaping.
Are there any concerns that a change of the federal government may undermine much of the progress made on tobacco and nicotine use?
Well, yeah, I mean, this is the issue. And I would say the answer to that question is 360,000. That's the answer. That's how many school-age youth are vaping right now and risking nicotine addiction as we speak. And that's 360,000 too many. That's a social failure. That's a government failure.
Do we have any data for youth-initiated cigarette smoking after using vaping products? I think you
Yes,
did comment
kids who
on that.
vape, I had a slide on that. Kids who vape are 2 to 3 times more likely to start smoking.
That's right.
And that's a huge risk factor. That's, to me, that's almost as important as the fact that nicotine is addictive, is that nicotine addiction by vaping can also lead to smoking.
Okay, let's see. Is too much of this falling on schools who have other important responsibilities like teaching? Can you speak to the roles of
Yes,
parents, families, and other support systems?
couldn't agree with you more. Absolutely. Schools have enough to deal with. Kids are supposed to be learning something, not bringing all their social problems, right? I mean, we should be working with schools, but we should also be supporting programs that address these things before they end up in the classroom. Primary prevention, it's called. And the best form of primary prevention happens before kids start school.
Okay, let's see here. Understanding that the fundamental health impact of both smoking and vaping is a nicotine addiction. From a medical standpoint, why is nicotine addiction a bad thing or harmful?
Well, I wish Dr. Tulloch was still on the line.
Yeah.
But nicotine is poisonous in the right amount. And in the amount that it's used for smoking and vaping, it increases your heart rate and can lead to cardiovascular problems, just the nicotine itself. Now, if we're talking about relative risk, the relative risk is much, much lower than smoking, but tobacco is pretty much the riskiest thing you can do on the planet. So it's not fair to compare the risk of almost anything, any other product, to tobacco that kills half of its users when used exactly as intended. Like, this is a uniquely harmful product. That doesn't mean that vaping products are innocuous.
Okay, we've got a couple of minutes left. I'm going to go through just some comments that people have made. So according to the Urban Dictionary, zonic, with one N, means to be incredibly awesome, often idolized, which interesting to what you were talking about, Les. A comment retaking the doors or inserting vaping detectors in schools. Those students who don't vape are actually afraid of using the bathrooms for fear that they are thought to be the culprits. And again, schools can barely keep kids inside the classroom based on lack of funding and staff. Do they expect staff to physically remove vapes from them? Kids fighting in schools is enough already. Public health has no capacity to send inspectors to find youth who are supplying it to those under 18. So some really good comments. Okay, do we have time for one more?
I do.
Do you think we may be experiencing a larger new silent issue with nicotine pouches, versus vape products due to their discreetness? Vaping is detected in schools much easier. Will we have a bigger nicotine dependence coming in the months or years?
Well, here's another bold and controversial statement. If a kid is using a vaping product and is detected doing that, I don't think that kid is very good at vaping, because it's a stealth product to begin with. And if you can't go down a stairway and have a little puff or something, you know, like we were all kids, and to me it would seem to be pretty easy to sneak in a few puffs of vaping undetected.
Okay, so, again, I think that hopefully you'll be able to answer some of the other questions so that people can walk away with getting their questions answered. But thank you, Les. I'm going to hand it over back to Kelsey and Alexi to take us home.
And thank you very much.
Great
Thanks.
presentation.
Thank you so much, Les, for that presentation, and Rosa for moderating our discussion. We really appreciate everybody's participation today. It's been great to see so many questions, so much conversation happening in the chat. So as we've mentioned, this session is recorded. We'll be sending out the link to the recording for everybody next week, and it'll be available on CPHA's YouTube channel and on our website. And we'll do our best to send along some of those resources and answers to some of the questions that we didn't get to. Apologies, but again, we're so happy to see so much engagement with this topic, and we thank everyone for your participation today. And again, a huge thank you to our panelists and to you, Rosa, for moderating. We hope everyone has a great rest of the week, and please reach out to us by email with any questions. We'll wrap it up there. Thanks so much, everybody.
Thank you so much.